Hi, I'm so happy that you've clicked on this video. I'm really excited to tell you a little bit more about the BBRT Masterclass. Now, just off the get-go, I want to mention that this is not all about CPD points. In fact, when you invest in this masterclass, you're not investing CPD points. You are investing in yourself. Yes, you are elevating your skill set as a clinician or therapist. So this BBRT is for the discerning clinician who really wants to upspec themselves in terms of new modalities and modalities that actually work. And it's also to be able to, if you want to, expand your practice, because I can tell you from a first-hand experience that this has really expanded my practice to the point where I actually needed to more clinicians to assist me in my practice. So what has happened is other clinicians through and colleagues through word of mouth, they've actually referred their patients to me with acute presentations where they're experiencing really severe debilitating symptoms, and I've been able to assist them in 1 or 2 sessions and then refer them back to the original clinician or colleague that actually saw them in the beginning. So really this modality, as you can hear, complements any other modality, any skill-based modality, or even the psychodynamic process. You can use this in conjunction with any other therapeutic process. So let me tell you a little bit more about BBRT. BBRT stands for binaural beat reset therapy. Now, reset is it's an acronym for quite a mouthful, but I'll say it slowly. Reset is an acronym for reconsolidation, enhancement, stimulation through emotional triggers. So that is a mouthful, but basically what happens is through neuromodulation, we actually stimulate the brain in order to create its own binaural beat. Now you can think of the binaural beat as, stimulating the brain into a repair mode. And so there's a process that we follow, and actually it's really, really exciting to see the results of this particular modality. In fact, you'll see 2 tabs. The one is linked to Cape Town, the masterclass in Cape Town and Johannesburg. If you click on any one of those to enroll for the masterclass, you'll be able to view a brief case studies that I've put together for you to just have a look at. The one case study that comes to mind that's quite extraordinary is the one where a lady was addicted to nicotine for 40 years. She just tried about everything to quit, and she was in quite a bad way. She needed to quit and actually quit that addiction and dependency because of her health reasons. And she was able to do that after engaging with this process, BBRT, for 1 session. So that was really, really amazing to see. So if you think about BBRT as a modality and actually learning to implement this modality, you are going to be investing in yourself. You're going to be able to elevate your skill set. You're going to be able to expand your practice and actually be more relevant, because I'm sure you've had those cases of patients who have these severe symptoms. They are so debilitated by them that they cannot function optimally. In fact, so when you want to engage with DBT or CBT or any other skills-based modality, cognitively they just have this block, right? Because that's what trauma does, or severe depression does. It actually blocks off the frontal lobe area. And when it comes to trauma, research has shown quite plainly and clearly that the Broca's area responsible for verbal expression is compromised when you go through trauma. So when we try and engage with traditional talking therapy and purely talking therapy, it takes a lot of time. And with these debilitating symptoms, I'm not saying it doesn't work. It's what I use all the time. All those traditional modalities I use all the time. But what I like about BBRT is that you're able to provide instant relief when it comes to these debilitating symptoms, because it actually works on neuromodulation and stimulating the brain to repair and heal itself.
So let me illustrate what happens here. Please have a look at the diagram. You see, when we have trauma, the memory of the trauma and all the negative emotional triggers become fused with the trauma. And with BBRT, we're not necessarily concerned about the trauma itself, but with the negative emotions that has been fused with the memory of that trauma. And because it's been recorded, so to speak, in that way, it keeps coming up for the client or the patient in their day-to-day lives because it becomes triggered by different experiences. So now, when we look at BBRT, we're able to treat the areas of the brain that we cannot through traditional talking therapy. Remember, with traditional talking therapy, if you look at the diagram, we normally are dealing with the prefrontal cortex, and we cannot access or treat the other areas of the brain. But with BBRT, we actually are able, through neuromodulation, to impact or have an impact on the thalamus, the hippocampus, the amygdala, the pituitary gland, and the hypothalamus. So we stimulate the brain in order to target the areas that's impacted by trauma and other negative debilitating symptoms associated with anxiety, addiction, depression, and so on. And once these symptoms have abated, we then can proceed with any other treatment as it is indicated. So the patient will still remember the traumatic incident, or they'll be able to talk about it, any disturbing experience, but without the negative symptoms and emotions associated with that experience or trauma. You see, the negative emotions and the intensity of the debilitating symptoms are diffused or neutralized. Or you can think of the memory, the negative emotions associated with the memory being separated, not fused anymore, separated